Do you have a loved one who's having trouble making the decision to get help for their OCD? Exposure and response prevention requires a ton of effort. You have to face your fears, so it's not an easy treatment to do. You got to give up your rituals. So don't be too surprised if the person that you care about is less than enthusiastic about doing this kind of treatment. It's also the case that your loved one might be ashamed of their intrusive obsessional thoughts and don't want to talk about it to anybody. Or maybe they're just really afraid that if they do exposure therapy and response prevention, give up their rituals, they're going to put themselves in danger of harming someone or getting sick or something like that. All these things might prevent your relative, your loved one, from getting help. And in this video, we'll talk about why deciding to get help for OCD can be a really tough decision. Hey, now's a good time to remind you to please smash on that like button and subscribe to my channel so that you can receive notifications when new videos come out, usually about once a week or so. So the reality is that your loved one probably has mixed feelings about getting help for their OCD. On the one hand, OCD sucks. You have all sorts of unwanted thoughts and you gotta waste your time doing all these kinds of rituals. It often gets in the way of a person's functioning, can cause problems in relationships and in families. On the other hand, though, it's really scary to think about using a treatment like exposure and response prevention, or ERP. These kind of mixed emotions are normal. I see it all the time in my patients, and we call that ambivalence. It's basically the state of having opposing positive and negative feelings at the same time. Maybe the person that you love is fed up with all their religious obsessions and compulsions, but at the same time, they're worried that treatment's gonna turn them into an atheist. Maybe your son is tired of being stuck in his room all the time because of the fear of contamination in other parts of the house, but then he's also afraid that he's gonna get sick if he has to do exposures that involve leaving his room. The thing about ambivalence is that it doesn't push your loved one in any direction. Instead, what it does is kind of keeps the status quo. Nothing is gonna change. What that means is continuing to struggle with OCD. Psychologists James Prochaska and Carlo Di Clemente identified 5 stages of change that people go through when they're thinking about doing something to change something about themselves and how hard to work at it. The first stage is called pre-contemplation, and this is typified by someone who wants absolutely nothing to do with getting help. They might avoid discussions about getting help, and probably don't consider OCD a big enough problem to seek treatment for. The next stage is called the contemplation stage, and this is where your loved one might be considering getting help. They can maybe see some of the benefits of doing treatment. They're bothered by OCD and would like to get over it, but at the same time, they're mindful of the process of exposure and response prevention, how much work it's going to take, how scary it can be, and that's usually what leads to putting off making any changes. Now, if your loved one has maybe made calls to treatment providers, or maybe asked you to make calls for them, or maybe even scheduled an appointment, then they're thinking more seriously about getting help. And if that's the case, then they are in the preparation stage. And if they've actually begun getting help, medication, exposure and response prevention, they're in what we call the action phase. Finally, if your loved one has been getting help for OCD, maybe they're making progress, then they're in what we call the maintenance stage. Maybe you're trying to figure out why your loved one refuses to get help. Here are some important factors that can reduce a person's incentive to get treatment for OCD. First, pure and simply, it's the fear of doing ERP. Look, your loved one has to face their fears. They have to resist their rituals. This is not an easy thing to do, as you can imagine, because we've all been in feared situations. It's really uncomfortable, especially for someone with OCD who has spent a great deal of time and effort working hard to try to avoid feeling anxious, avoid having obsessional thoughts. Now, we're going to ask them to go and confront their fears. Your loved one might be afraid of experiencing too much anxiety. They might be afraid of talking about their fears with a therapist. They might be afraid of giving up their rituals. So at least to some extent, the perception that ERP is going to be really challenging, that can lower incentive to engage in treatment and seek help. A second factor is what psychologists call poor insight. People with OCD vary with respect to how much they really believe that their obsessions and compulsions are realistic. Most people with OCD are kind of on the fence. They recognize that their symptoms are senseless, but there are some people that have poor insight. They really strongly believe that their obsessional fears are realistic and that their rituals actually do serve to prevent some sort of disaster from happening. They're going to find exposure and response prevention really challenging, really aversive, and really scary. Now, I don't talk a lot about medications, but another factor that can influence whether someone gets help using medications are negative attitudes about medications for OCD. Maybe your loved one would perceive themselves as stigmatized or weak if they have to take a medicine for a psychological condition like OCD. Maybe taking medication would make them feel like they're not able to manage their problems on their own. Maybe they've tried medications before and they haven't been helpful. After all, there are a lot of people for whom medications don't work very well for OCD. And of course, your loved one might be wary of side effects that are pretty common with the various types of medications that are used to treat OCD. All of these concerns will reduce incentive to get help, especially using medicine. Now, believe it or not, some people with OCD have a fear of getting better. And this is another factor that can lower incentive. What do I mean by that? There might be a part of your loved one that feels threatened by the idea of getting over OCD. And that's especially true if they've had the problem for a long time. Maybe they've just gotten used to having obsessions and doing rituals. Maybe they've gotten used to feeling anxious. Maybe they've accepted not working, not having much of a social life, not having a lot of responsibilities. If that's the case, he or she might be wary of new responsibilities that might be put on them or expected of them if they were to get over their problem. Now that I've gotten over OCD, I have to succeed at school, I have to move out on my own, I have to get a job and earn my own living, I have to take care of my space, I have to push myself socially. And unfortunately for some people, living with OCD can seem like the lesser of two evils. Another factor that can reduce the incentive to get over OCD is hopelessness, helplessness, depression. There are some people with OCD that feel like it's not worth doing the hard work, putting in the effort in order to get better because they feel like they're not worth it. They don't deserve to have a happy life. They don't deserve to feel better. If that's the case, then doing all the work in ERP would hardly seem worthwhile. It's also possible that your loved one feels discouraged. Maybe they've tried treatment before, it hasn't been successful, so they feel hopeless about the prospect of getting better by trying it again. Another reason that people lack the incentive to get help is what's called symptom accommodation or family accommodation. And this is when members of the family change their behavior to try to make it easier for the person with OCD. Let's suppose I have a son who is afraid to come out of his room because he thinks the rest of the house is contaminated. If I take his meals to his room for him, or if I go and I clean up everything for him, then he never has to bear the brunt of having OCD. And if that's the case, OCD falls more on me than it does on him. So the incentive for him to get treatment is really low. Essentially, accommodation makes it easier for the person with OCD to live with OCD. And again, that lowers incentive to do a challenging therapy like ERP. Another factor is denial. People with OCD might deny their own symptoms, but also other family members might deny or downplay the severity of the OCD. They might avoid talking about it. They may look the other way when rituals and other sorts of avoidance patterns come up. And what this does is this downplays the whole problem. And the result is that the person with OCD doesn't feel like this is enough of a problem to do anything about. And then finally, conflict and hostility in relationships, and particularly at home, can be a big factor why someone might not want to pursue treatment. These kinds of negative interactions reduce incentive for getting help. So I'm really sorry if someone that you love happens to be in those first two stages of change where they're just not interested in getting help at this point, and they're refusing treatment. I'm going to have more videos on the things that you can do to try to help in this situation, but sometimes just understanding the problem can be a good first step. And I hope that this video can be useful in that way. Thanks a lot for watching.